job technology-wise. So I am going to hand it over to our presenters, Allison and Alex. And I hope that you have a great seminar tonight. So thanks for being here.
Thank you, Sharon, for that introduction. Welcome, everybody. Again, just really glad that you guys could all be here for our first virtual workshop. Just a couple of quick housekeeping things. With the Zoom, you have a chat function. So for the majority of this presentation, everybody's going to be on mute. So we do ask that if you have any questions or comments, you could put it in the chat function, or if you are like me and you still use a notepad and pen, and you're jotting down questions and stuff, again, there'll be a time at the end of the workshop where we will address questions and any comments. There will be one slide during the workshop where I will invite whoever would like to participate in a little discussion to unmute themselves. So at that time, it would be fine if you want to speak and involve yourself in that discussion. In the chat function, you will see Jessica sent out a link to some handouts and some resources. So feel free to, throughout the presentation, after the presentation, whatever, take a glance at them. You can print them, you can download them, whatever you need to do or would like to do with them, they are yours. There will also be a link for a survey that you could, if you don't mind, take at the end of the workshop. It's super quick, just to kind of, again, let us know how we did and if there's anything you'd like to hear about in the future. I'd just like to start real quick to take a poll from everybody here. Just if you could just mark like what age range you're kind of coming here for today, just so we have an idea of which way to gear the presentation. That would be great. All right, thank you guys so much. Looks like we don't have any 0 to 5-year-olds, so I will not focus on that age group. So thank you all so much for taking this poll, because that definitely is helpful, and I won't have to touch on information that isn't relevant to you. All right, I'm going to go ahead and get started. So when I first meet with a client, I have what I call like a spiel. Alex also has her spiel when they first come in, so that we can kind of set ground rules, explain confidentiality, anything that we're legally as clinicians obligated to do. So I just want to kind of give a little spiel to you guys as well. This is in the state of Pennsylvania. The age of consent for a child for mental health is 14. So what this means is that if you were to bring a 12-year-old in for treatment, you would be signing all of the consent forms. As their caregiver, you would be involved in their treatment plan. You would be signing their treatment plan. You would be signing releases of information to whoever you thought it would be necessary. And then you would be determining what information it is that gets communicated to that person. You would also be able to consent to medication or not. When the child teen is 14 years old in the state of Pennsylvania, they get to do all of that. So they're the ones signing their consents. They're the ones signing their treatment plans. They're the ones that are signing releases of information. So what I like to just let people know is, of course, as a clinician, I'm going to be communicating to the caregivers, but in order to do that, I need the 14-year-old, 15-year-old, 16-year-old to sign a release of information. And on that release, it will state what it is that I can and cannot release to them, to you, the parent, or to the teacher, or to whoever the release is for. They can also consent to medication or not at that age. So I just like to let people know that ahead of time. Of course, there are things that we, as mandated reporters, have to report, which is any child abuse or neglect. We also will report or share if their child or teen is a danger to themselves or others. In the state of Pennsylvania, the child abuse reporting laws have changed a bit over the years. And I just like to let people know, you can tell me that Sammy down the street got hit by a belt by her dad last week, and I would still have to report that, even if I don't know Sammy and never will know Sammy and have never met Sammy. But in the state of Pennsylvania, as a mandated reporter, that is still something that we need to report. So I just like to let everybody know all of that up front ahead of time, like boom, so there's no surprises. So Alex and I are going to be kind of focusing our presentation on a more broad piece of anxiety, because anxiety is so big and there's so much that goes into it. There's so many specific disorders with anxiety that we would be talking forever. So we're going to approach it from a more broad perspective. We are going to touch on some of the more specific anxiety disorders, but please, if you have any questions about a specific anxiety disorder, you can make note of that in the chat, or we can address it at the end of the presentation. So generalized anxiety disorder is one of the more commonly diagnosed anxiety disorders. I've listed here the criteria and symptoms of generalized anxiety disorder, just to give you an idea. So if you have a kid who has a presentation on Friday and you see that on Wednesday they can't stop talking about it, and they maybe are having a little bit of trouble sleeping, and they don't really want to eat anything, and maybe they're starting to have like little crying spells when they're trying to work on their presentation, and then the presentation's over on Friday and everything goes back to the way it was, and your child is no longer exhibiting those behaviors. So that is anxiety, 100%. We all experience anxiety in some way, shape, or form, especially with presentations. But this first bullet point is really important, because this is what kind of determines it from like, okay, we had some anxiety versus we have an anxiety disorder. So the disorderly part is when it's lasting for longer periods of time, and in this case, at least 6 months, and that it occurs more days than not. So you would be seeing it, 5 out of 7 days a week or something like that. These individuals have difficulty controlling their worry. They, could spiral. They have difficulty concentrating. So you might see that with school. You might see them like forgetting to do tasks around the house. Their minds can go blank because they're so preoccupied on doing, on whatever it is that's making them anxious. They can be restless or be kind of like keyed up on edge. So oftentimes that looks like muscle tension, and then sometimes the reaction looks like irritability. This can cause them, again, to be fatigued, a little bit tired because they're getting so worked up so often. And also they can have trouble sleeping. So they might have trouble falling asleep, staying asleep. So they may be able to fall asleep at night, but then once they're asleep, they're waking up periodically, or they're waking up and they can't go back to sleep. And that's never a good thing, especially for the teens. So these are kind of the other anxiety disorders that we had under the umbrella. These are the more specific ones. So I'm just going to touch on them briefly. All of the disorders here can be found in children and adults, but there's 2 that are specifically found in children, and those are separation anxiety disorder and selective mutism. So separation anxiety disorder is often found in younger children. So you see this when, maybe they're having a really difficult time when they're getting dropped off at preschool or daycare, or if mom or dad or a caregiver has to go to the grocery store and leave the house. And it's even gotten, I've seen it as severe as like parents can't leave the room without the kid having a really difficult time. There are also specific phobias, one of which is quite prominent at this point in time is germophobia. So I'm sure you guys have heard of this. It's where you're afraid of germs. So that's everywhere right now. We're approaching Halloween, so there's also arachnophobia, where you have a fear of spiders. And I have listed here agoraphobia, which is the fear of leaving the house. And that and panic disorder go hand in hand. Panic disorder is when somebody experiences panic attacks with their anxiety. If you've ever experienced a panic attack, or you've ever witnessed somebody experience a panic attack, it's very scary. So these people tend to not want to leave the house because they're afraid of having a panic attack. So then they develop agoraphobia. Social anxiety disorder is something that we see in children, adolescents, and adults. It's this fear, anxiety around social gatherings. So you might see it with kids, like if there's a lot of kids in the classroom, or maybe at a birthday party, or in the grocery store, where they're getting overly anxious about being around other people. Selective mutism, when that's in children, they know how to speak, but they choose not to because of the anxiety surrounding that. OCD is short for obsessive compulsive disorder. So with this, there are obsessions, which are actually like thoughts that are very anxiety provoking. And so then the person develops compulsions, these behaviors, to reduce the anxiety. So if we go along with the example of germophobia again, you know, if say a kid goes, you know, has to go outside to the mailbox and get the mail out of the mailbox, and they come back in and they're like, but oh gosh, I touched the mailbox and the mailman touched the mailbox. And now I gotta like, oh, what am I gonna do? Am I gonna get COVID? Am I gonna get sick? What's gonna happen to me, right? So now these obsessive thoughts start and the anxiety's rising. So you go and wash your hands, because that behavior is going to relieve the anxiety. I'm washing my hands, I'm getting rid of the germs. Now it becomes a disorder, of course, when it becomes like very obsessive and is happening more frequently than not. Then there's also PTSD, which is short for post-traumatic stress disorder. And with this one, there is a traumatic event that happens, and usually this event is life-threatening in some way, or is very threatening to the person's safety. And as a result, their brain chemistry changes, and you see heightened, like we call it hypervigilance, when they're kind of like overly cautious and reactive. You'll see an increase in anxiety. You might see some depression, some nightmares, some flashbacks, and some avoidant behavior. So we can't say that there's like one specific cause of anxiety. There's definitely a genetic biological component to it. And then there's environmental factors that are involved as well. Dr. Nuthi is going to speak in much more detail about the biological component a little later in our presentation. But I can give you like a little snippet. So basically, there is a part in our brain that controls anxiety. And in this part, there's chemicals. And when when this part of our brain is triggered, the chemicals are released, and we feel feelings in our body related to anxiety, such as like sweating or heart palpitations, or like an icky feeling in our stomach. And basically that is happening. So it's supposed to be like alerting us to danger, and it's a survival technique. So it's built into our brain for a purpose, which is to help us survive. The chemicals are called neurotransmitters. And if they are kind of out of whack, then we can develop an anxiety disorder or depression or mood disorder. And that's where medication can be helpful with regulating that. Again, Dr. Nuthi will go into much more detail about this later. There are environmental factors that, of course, play into the cause of anxiety. And I've only listed a couple here. So I'm sure that there are many more, but low self-esteem is certainly one of them. So if you see kiddos or teens that maybe aren't feeling real confident in themselves, not feeling really good, don't have a really high opinion of themselves. You're going to see them be more doubtful and maybe more cautious and more worried about things. As I kind of mentioned before with PTSD, like a history of trauma can also lead to more anxiety or anxious behaviors. And the last one we have listed here is family conflict. And right now, we're at home with our families and we are pretty much stuck there at home with our families. So when there's family conflict now, it's even more so that it could be causing some anxiety, stress, tension within the household because we don't have our usual escapes and outlets that we're used to having, 6-7 months ago. I just like to give like little, like an idea of where our kids' brains are at, I guess you could say, when we're trying to implement things, teach them, and us, of course, with our expectations of them. Like, are we being realistic with them depending on where they are in their developmental stages? So, between the ages of 3 and 6, this is what children go through. They are being able to self-regulate more. They have more impulse control. They develop a conscience, self-esteem, more internalized sense of values. Their brain is growing rapidly. They're improving their perceptual abilities, motor skills, integrating functions of the left and right brains, which helps them to understand words as well as emotional meanings of the words. So when you say that you're sad, they can actually connect that to the feeling. Relationships begin to focus more on peers and friendships begin to develop. Memory improves, cause and effect thinking develops. Egocentric thinking, it persists, causing inability to view another's perspective. Guilt develops and the ability to pay attention is diffuse. So you're not getting a whole lot of attention span with these guys yet. Between the ages of 6 and 12, children have an improved ability to self-regulate. They now have a sense of right and wrong, allowing them to accept responsibility for their actions. Egocentrism is decreasing and they are able to be more objective. And they are more peer-oriented. Self-esteem and view of self are more based on recognition and acceptance by peer group. Parents' attitudes and circumstances can have a strong impact on the child's transition into school. So what this means is basically like, if you have a kind of an upbeat, encouraging, positive attitude towards school, your child is a little bit more likely to have the same kind of attitude. Attention is more focused. Desire to receive approval from peers sets limits on impulsive behavior, and they have cognitive understanding of rules, norms, and norms of correct behavior. From the age of 13 to 18, the brain is still maturing and hormones become a factor. Adolescents develop the ability to think abstractly, set goals, and think long-term. They compare themselves to their peers and peer relationships, and acceptance become very important. The ability for long-term commitment in relationship forms, and they may fall in love. There's a struggle for independence and control. I'm sure none of you who have teens know what I'm talking about there. And they may want more independence from their parents. Egocentric thinking is still present, so they're still very focused on themselves. So at this time, I just wanted to invite anyone who would like to share a little bit to unmute yourself, and we can discuss a little bit about how COVID-19 is affecting anxiety for you personally, whether it be your own anxiety, anxiety in the children you work with, anxiety in your own children, anxiety in your household, in your workplace. If there's anything that anybody would like to share at this time, I just ask that you please be respectful of others and try to speak one at a time.
not a very talkative bunch. I'll jump in there.
Okay.
I'm concerned about being exposed to the virus and how being around a group of people, particularly people who are choosing not to wear masks, how that makes me vulnerable.
Absolutely.
Yeah. And I wonder how the kids that I'm working with are impacted by that, wearing a mask. I have one kid who we were working virtually and I coughed and he said, "Are you okay? Do you have COVID?"
Mm-hmm.
But that's a real fear for, I'm sure, a lot of the kids because they're inundated with all this information and they process it very differently than we do as adults.
Absolutely. I get self-conscious when I have to sneeze. If I'm in the store or something, I'm looking around like, I swear I'm okay. Like, I just had to sneeze.
I was having a hard time navigating the pandemic because none of this is our first time, all of us, navigating COVID-19. So a lot of people, I'm sure everyone here has some teen or child in their life that they're trying to provide support to. So it's really difficult trying to provide them that support and ease their anxiety when we're trying to ease our own anxiety. So, and I'm trying to manage not projecting any of my own anxiety onto other people, but also not minimizing to other people how serious it is. So a lot of my kids and teens are asking me a lot of questions about it. And is it really that scary? I don't want to be like, yeah, it actually is. But also, I kind of do because I don't want to minimize it. So I can see how all of us are in this tough position right now. Like, again, we haven't done this before. So we're trying to find all the answers in the moment, really.
So true. We're all in this together right now. Well, I do have a couple things listed here to talk about. And I mean, this was touched on, of course, like the fear of illness and, being afraid of getting sick and then also being afraid of dying because you're sick. So the heightened anxiety just around that. I've been seeing a lot of that. Masks. I mean, I feel like I'm getting more used to seeing people in masks, but I know that little kiddos, especially, if they're used to seeing somebody and they're used to seeing their face, it's a little bit scary for them to see people wearing masks all the time. And then also for them to have to wear one. It's it's uncomfortable and it's, maybe they don't want to wear it. And then, of course, then we have to explain to them, well, we have to wear the mask so we don't get sick. And then it's the whole conversation of, oh, well, what happens if I get sick? Will I die? Will I throw up? Will I have a fever? And then it's this whole conversation of explanation. And it's, trying to provide them the facts in the best way that we can, but also trying to reassure them that there are ways to keep ourselves safe. And so the masks are one of those ways that we keep ourselves safe. Another thing I see affecting anxiety is social distancing. So, we just can't be with our people that maybe we would want to be with. We don't have our outlets that we may have used previously. It's not like you can just, a group of you all get together and go out to dinner at a restaurant for a night, or you can't take your kids to the amusement parks, and it's just so different. So not having those kind of outlets, I feel like has really affected people's mental health as well. Virtual learning. This one is certainly tough because I know I've been talking to teachers and parents and kids, and everybody's experience seems to be a little bit different, but I know that end of August, everybody was super anxious about this because nobody knew what it was going to look like. And everybody's like Alex said, navigating this for the first time. So I feel like, teachers are anxious about, oh my gosh, how's this going to work? What is this going to look like for my classroom? How am I supposed to teach? And parents are anxious about, having to be home with their kids and trying to work and trying to be a teacher, and then the kids are anxious because they're going to be home and they're not going to be with their friends. And but are we maybe going to go back for a little bit? Are we going to school for a couple of days and coming home? Or are we just going to be home? And it's all this uncertainty around that. But from the kids that I have spoken to that are doing the virtual learning, honestly, most of them are adjusting, which is fantastic. Fantastic news. The last thing I have listed here is childcare and how that can affect anxiety during this time, because parents are working from home and their kids are home doing school. And now they have a role of being a parent and being a teacher and working. And that's a lot. And so anxiety around those things has certainly increased too. Before I move on, did anybody else want to share anything?
I just want to say with social distancing and virtual learning, I was not surprised, honestly, I expected it, but a lot of anxiety for my teens and kids has come with socializing again. They lost socialization for so long, and even my most social teens ended up coming to therapy with concerns about, I honestly don't know how I'm going to socialize again. It's been so long. So I just wanted to say that because I imagine that could come up for a lot of teens now, or if they're not talking about it, to maybe address it. Because I got to be honest, I even felt that way. I've been isolated, and yeah, I'm doing therapy every day, but when I can see people again, or if I socially distance saw a family member, it felt different. So I think it's an important conversation to have with teens and kids. I've been initiating a lot of role plays, honestly, with kids on conversation skills, because that's how much anxiety it is producing.
That's definitely true. I've been seeing that as well. Anybody else?
Can I share? Hello?
Olivia?
Yes.
Hi. So it's actually different for me because my 6-year-old, almost 7, there's a big struggle. She's in first grade, and all of last year of kindergarten was constantly crying because she didn't want to go to school. And now that she's home, she's in heaven. And now like, she needs a socialization because she has such, she doesn't have diagnosed anxiety, but she's definitely an anxious kid. So, like, this is just hindering her, not helping her. Yes, she's happy as a clam, but it's not helping
Right.
get away from us. Do you know what I mean?
Yep, absolutely. They miss that social piece, the social emotional learning. Yep.
Right.
Thank you for sharing. That's a big piece.
I think a lot of people can probably relate to that too.
Mm-hmm. So anxiety, of course, affects the individual, but as we're kind of talking more here, you can see the ways that it affects the family too. So, it's not just this one person that's anxious. And I like to call anxiety contagious because you can like feed off of somebody's nervous energy. And as, a caregiver, if you're with somebody who's anxious, it's not abnormal for you then to become anxious and keyed up as well as you're trying to deal with that person. And like an example that always comes to my head is like trying to do homework with a kid who is stressed out and anxious about an assignment that maybe they don't understand. And then the parent is, getting all stressed out and worried and upset because they're not sure how to help the kid, or they're trying to help them and they're not being receptive to it. So some other emotions that come into play there, of course, are frustration, where maybe the teen is worried about something that you're not really understanding why they're worried about that. Like, it doesn't really make sense to you that they should be worried about that. So that can be frustrating. Or it can be frustrating when they are speaking negatively about themselves because they've gotten themselves so worked up and so anxious that now they're stupid, they're dumb. And you know that they're better than that. You know that that's not them. And it's frustrating to hear that, and also upsetting. It's important as caregivers, and I'm sure everyone's heard this before, to keep up with our own self-care. so that we are better prepared and able to take care of those who are dependent on us and those who need us. And I know, again, like this day and age, it's even more difficult to engage in this and find the time to do that when we're wearing so many hats and juggling so many things all at once. But just finding that like half hour to read a book or take a walk once a week or go to bed early or take an extra long shower, whatever it might be that you do to take care of yourself, it's just super important when you have people who are depending on you, so that you're better able and better equipped and you can be more patient and you feel like you're not running on empty. That being said, reaching out to your supports and staying connected is also really important. And technology is absolutely wonderful. And I feel like that it has allowed us to kind of stay in touch, at least in this way. But if you're not like a tech savvy person like me, you know, phone calls, texts, I've written some letters, sent some cards, just to stay connected to the people that are my support system. Just again, it's like a way of self-care. So within the family too, there are dynamics, relational dynamics between people, and anxiety can affect those dynamics. So one example I like to give is if you have a household or a classroom where you have multiple children and you maybe have one child that's really struggling, and so they are a bit more demanding of your attention. They're more needy. And so then that causes you to kind of neglect perhaps the children that aren't as needy and aren't having as many struggles. And so what you often see happen then is you might start to see some behaviors from those other kids because they're not getting the attention. So it's something just to keep in mind when you have a child that is experiencing anxiety or some other struggles, that you know, you are just one person, like getting some help and support in there is definitely needed. And then also just to keep in mind about the other kids within the family, within the classroom. So there are a number of different treatments for anxiety, and I just want to start by addressing how you get treatment. So if you are deciding that your child or teen could possibly use some mental health treatment, one way you can go about doing that is if you have insurance. Most insurances do have a mental health benefit, not all do, but you can, there's a number on the back of your insurance card that I think it says member services. And you can call that number and they will provide you a list of providers in network with your insurance. If you don't want to go the insurance route, you can always look clinicians up online, Psychology Today, or you can look for like kind of your community agencies. Like in Bucks County, we have Lenape Valley Foundation, we have Penn Foundation. In Montgomery County, there was Northwestern Human Services. So you can kind of look into those agencies and to get started there. There are different levels of care. So if you have a child or a teen who's in like a crisis situation and they are to a point where they can't keep themselves safe, or you're worried that they can't keep themselves safe, the highest level of care that's available is inpatient. And so what inpatient is when the child or teen or adult goes to a facility for no less than 72 hours. They're closely monitored. They stay there, they eat, sleep there, they're group therapy, they meet with a doctor, they have an individual therapist, they probably also have a social worker. So they pretty much live there for whatever the determined time is. A step down from that would be a partial hospitalization program. So it's less, you know, they aren't living there when they're in the partial hospitalization program, but they go for about 2 weeks usually, and it's a day program, so it's from 9 to 3. And again, it's just it's intensive therapy, so it's groups, it's individual. I believe they also have doctors on staff for that. The next step down would be intensive outpatient. That for kids and teens usually occurs after school hours, and it's a couple days a week, and it's usually group therapy, and it's for a couple hours at a time. At Lenape, they have one for adults, and that's usually in the morning. That is in the mornings. We also, at Lenape, we have a wraparound program. And what this is the team, well, not so much now, but the team goes out to the homes and we'll meet with the family there. The team usually consists of a mobile therapist who provides like the therapy piece, and then the behavior specialist who works primarily with the caregivers to develop a behavioral plan. Depending on what the psychologist who does the evaluation recommends, there could be a case manager involved or a one-on-one involved as well. Family-based services is like a more intense level of wraparound where the therapy's happening more frequently and it's a little bit more intensive. At Lenape, what Alex and I do is called outpatient. So that's when the client comes to us and we meet weekly, bi-weekly, monthly, whatever is needed at the time. And we provide individual and family therapy. So again, like you can kind of like go through, you can look through your insurance to see what's in network for that. Cognitive behavioral therapy is a therapy that we use to address anxiety specifically. The basis of cognitive behavioral therapy is that thoughts, feelings, and behaviors are all connected. And if you can change the way that you think about something, it could change the way that you feel and behave. Medications, of course, are another option, another treatment for anxiety, and Dr. Nuthi will be speaking more on that in a little while. So here are a couple things, interventions and skills to try with kids and teens to try to help to minimize anxiety. So we have this kind of overarching sense of like the unknown, and that really is kind of like the fuel, I would say, for anxiety, and it can kind of cause it to become even worse the more we think about it. So if you take away or minimize that, the thought, the hope, I guess you could say, is that it would reduce the anxiety, which is why it's so important to have predictability and consistency. And that can be established by creating a routine and a schedule. And again, it's difficult these days when there's not a whole lot of reason to leave the house to create these routines and schedules. But in doing so and providing that structure, you're then giving the child basically a plan of of what to expect so that there is no unknown. Well, within reason, as much as we possibly can, right? Validation is a great skill to have and to use when a child is experiencing any kind of anxiety, depression, and it's also very difficult to use in the moment. So Alex and I are going to attempt a role play virtually to try to illustrate some of this. So we hope that you can get out of it what validation looks like.
So I'm going to be a teenager and I'm going to be having anxiety about transitioning from middle school to high school and going to a new building. You hear this one a lot. So Allison, you're my mom.
Okay.
I'm not going to school today. I'm so upset. Like I haven't seen the school yet because of the pandemic. I have no idea where I'm going. What if I have no one to sit with? I seriously feel like I cannot breathe.
Alex, will you please calm down? You're going to be fine. It's going to be fine. You've gone to school before. You'll be fine.
It doesn't feel fine. I don't feel fine. And
Alex, go to school. It'll be, you will not regret it. It'll be fine. I promise you. You can do this.
You don't understand me.
You don't have to answer, but does this sound familiar to anyone? Has anyone experienced this kind of interaction with their child or their teen? I know I've seen it. So we're going to try this again, and I'm going to try to illustrate what validation would look like in this scenario.
I'm so nervous to go back to school. I have no idea where I'm going. I haven't had a chance to see the building. I feel like I can't breathe. I feel like I'm not going to know anybody. I feel like I can't go.
Alex, I know this is like really difficult for you. I know you haven't been in school for a while, and it really is. It is anxiety provoking. I totally get it.
I just honestly feel like I can't breathe. I feel like my heart is racing. I can't stop thinking about, like, what if I have no one to sit with? And what if I can't find my classroom? And what if I don't like my teachers? It's freaking me out.
Well, and I feel like, you know, what you're thinking is totally valid, and what you're worrying about, again, totally valid. So why don't we just take a few minutes and listen to some music and see if we can't get you to feel a little better, get some deep breaths in there, and see if we can't calm you down.
So in that scenario, I was definitely validated. Not only was I validated and heard, but it was then offered a suggestion. I'm sure some of us know with teens, you might get even a little pushback on a suggestion from a parent or an adult. That's just what they do. I've done it as a teen. In that case, always come back to too, what can I do to help? Tell me what I can do.
It's always okay to ask like what they need from you in that moment.
And I like Allison in that scenario, you kept your voice calm. I notice a lot of times I work with parents, like, you know, we want the best for your kid. And we panic, crisis meets crisis, it makes us more panicky. So keep your voice calm, try it, and it will help kind of regulate the teens' emotions a little bit at least.
So other things to try are encouragement, which is kind of when you are building them up and you're trying to point out like their strengths and their positives. And Alex can attest to this as well, that if they are in a place where they can't hear that, you might receive some pushback. No, I'm stupid. I can't do it. I suck at this. In which case, that's when we would, you know, try to like gently continue to encourage and try to challenge that. Well, no, I mean, you did get like straight A's. So, I mean, that seems pretty much like you would be smart. Like, you can do this. You've achieved so much already. So encouragement is really just trying to build them up and focus on the positives. Modeling behavior is when we as caregivers, teachers, parents are trying to exhibit the behavior that we would like to see out of the children. So as Alex was saying, in situations where kids are getting activated, it's really easy for us to get activated too, because we just want to solve the problem. We just want everything to be okay. We don't want them to be worried. We don't want them to feel bad about themselves. We don't want them to be sad and upset. So it's just, what do you want from me? What do you want? You know, like, help me help you kind of a situation. So if we are in a situation where our child is getting anxious and we're getting anxious, it's only just perpetuating the cycle. Whereas if we can model some more calm, problem solving, planning behavior, like for me personally, just speaking out loud, like what I'm going to do, and providing like a step-by-step, I think has been helpful for me to remain calm. Is like, okay, so this is what I'm going to do, and this is what we are going to do next, and then we'll be here, and that's how this is going to work. So that's what has worked for me. But in that way, I'm able to maintain my own anxiety or my own frustration in the moment, so that my child is not seeing that part of me, though that happens anyway, because we're all human. So we have these moments, and that's okay. Totally normal. The last skill on here that we have is reflective listening. So this one, it can kind of look like a validation, but with reflective listening, you are actually more like repeating what they're saying back to them. So in that way, you are letting them know that they're heard. And then it's a little bit more difficult for them to give pushback. And now I'm going to kind of pass this on to Alex, and she is going to explain another really helpful skill with anxiety called mindfulness.
Hi, everybody. Just gonna fix my screen here. I don't know if I introduced myself yet, but I'm sorry about that. I'm Alex, also an outpatient therapist at MIT. So mindfulness is one of the most used tools to help with anxiety. So first, I just want to start with defining what mindfulness is. Mindfulness is the awareness that arises from paying attention on purpose in the present moment without judgment. So in short, being in the present moment, bringing awareness to how you're feeling and not judging yourself for it. So mindfulness is helpful because a lot of times when we think about anxiety, we're either thinking about things that happened to us in the past, such as trauma, or we're thinking about things in the future, things that have not happened yet. Mindfulness will bring us back into the present moment. So things like panic disorders, that's usually panic about panic. Social anxiety, it's a fear of embarrassment. Generalized anxiety, it's usually fear of the unknown. All of those things have one thing in common, and that's that they haven't happened yet. So what mindfulness does is help bring attention back to the present moment. Now I'm going to go more into some examples of mindfulness, but first I wanted to debunk the mindfulness myth. And the mindfulness myth is that a lot of people, and I know I have thought of it as just meditation. It's all Zen, and if I just close my eyes, I'm going to feel calm, and I'm going to forget all of my thoughts, and my problems are going to be solved. Well, mindfulness certainly does not solve your problems. It just puts you in a better position to regulate emotions to help you think about a better problem. I know I get a lot of pushback from teens when I try to teach them mindfulness stuff. I laugh because they're telling me they're not going to do my Zen stuff. I'm like, that's not exactly what it is. It's actually the opposite. It actually brings awareness to how you're feeling. It doesn't forget about the feelings. It acknowledges the feelings. And then I work with people on accepting their feelings. So for example, I think someone asked a question, what do I do if someone can't voice anxiety? Well, mindfulness might help with that because we're going to work with identifying how you're feeling in your body. So maybe you're noticing a racing heartbeat, ruminating thoughts. Maybe your stomach's upset. Maybe your hands are sweaty. So we're bringing awareness to our body. And then we're accepting, hey, maybe I'm feeling anxious right now. And that's okay. We're not judging ourselves for that. A lot of times people get into more panic or more anxiety because they are judging themselves for that. Maybe I shouldn't feel this way. Why am I feeling this way? So there are a lot of benefits to mindfulness. I just want to read a little bit of them. It can help someone become more in tune with their feelings and their body sensations, help someone bring awareness to their mind and body connection, improvement in memory and focus, and overall improve the ability to manage emotions. I love mindfulness because it can help someone respond rather than react. When we bring more awareness to how we're feeling and we accept them without judgment, we can calm down and we can regulate our emotions. And when we regulate our emotions, we're able to respond more clearly. If we don't do this, our emotions tend to get the best of us. And then that's when we react, especially teens. They might be experiencing all these emotions and all these feelings. They might not be able to connect them, the mind-body connection, and that's when they react. So mindfulness kind of helps bring attention to that and helps them work through it. And it can increase confidence in the child because once they're able to do this, I love when a teen comes back to me and says, I tried that thing you taught me and I was able to actually calm down and think clearly. So there are two different types of mindfulness practices, informal practice and formal practice. Informal is bringing mindful awareness to everyday activities. So I get it. We don't have time to sit down and do a meditation for 10 minutes a day sometimes. We can't always practice yoga. But what we can do is bring our attention to everyday things, like brushing our teeth. So when you're brushing your teeth, just noticing how it feels. Maybe just checking in with yourself. How do I feel? It's 2 minutes of your time when you can bring your own attention to it. Another thing is coffee. I know every day I'm very busy, but one thing I always have time for and always will have time for is coffee. So I will take that time and mindfully sip my coffee. Instead of focusing on my to-do list for the day, my patients, who I have to call, who I need to respond to, I'm going to focus on my cup of coffee, how it feels, how it tastes, and just really focus on that moment, enough to help regulate my emotions. So maybe it puts me in a clear headspace for the rest of Also, just mindful walking. You know, if you're walking to your car, just be mindful. Notice your feet on the ground. Notice how the air feels on your skin. Notice the weather. Just being mindful of the present moment in which you're in. There are a lot of formal mindfulness practices, and what this means is intentionally committing a time of your day to a mindful practice. So I mentioned meditation earlier. There's tons of meditations, body scans, guided imageries, breathing exercises, progressive muscle relaxation. That's a great one for people who can't voice their anxiety because it helps bring attention to areas where they are feeling anxiety. I had a teen once I did that with, and she didn't know it wasn't normal to feel tense in her shoulders and in her jaw all the time. And her heart was racing. And in that meditation, she realized, I'm not supposed to always feel that way. And I was like, you shouldn't have to feel that way all the time. Let's explore why that's happening and why you're carrying it there. Yoga is also a great way to connect the mind and body, and grounding skills, using your senses. So especially with kids and teens who are probably going to fight you on the idea of meditations or yoga, grounding skills are awesome ways to bring mindfulness. And one way to do that is using our five senses or something that are with us. So today I'm actually going to practice one with you. And so if you guys want, I write these on a Post-it note, and I'll explain it in a second because I will have kids or teens and adults write down what I'm going to practice with you so they can kind of carry it with them. Because sometimes when we're anxious and our thoughts are ruminating, we can't think of our coping skills. So it's nice to have a little reminder. So if everyone would like, you don't have to say it out loud. I'm going to say it out loud, but we can practice this together and I'll explain why it's useful. So I'll have kids use their senses. And first, when they're in panic, I'll say, let's name 5 things you can see right now. So right now, I see my lamp, I see my coffee mug, I see my water bottle, I see my fan, and I see the chair I'm sitting on. And then I'll say, okay, give me 4 things you can touch. So don't just touch them, explain them to yourself. So right now, I feel the seat I'm sitting on. It feels soft. I also feel scratch marks, which reminds me that my cats are ruining my furniture. I feel my skin, which feels a little bit dry, reminds me that the season's changing. I feel my tea mug, because tea, I do sip that mindfully. It feels still a little warm. And I also feel my desk, and I feel the wood and there's ridges in it. Next, I'm going to do 3 things I can hear. I hear a little background noise from someone. I hear the motor running on my computer. And I hear cars outside my window. So I'm right next to my window in a street. Next, I'm going to do 2 things I can smell. So there's always going to be something. I personally always keep like an essential oil. So maybe first I'll smell this. It's peppermint, reminds me of Christmas. And then I'm going to smell my tea, which is ginger. For kids who I say, what if I don't smell anything? I'm like, you'll find something. Smell your skin. You might smell the kid next to you. I don't know. There's something in the air. Try to really focus on something because we're distracting from the ruminating thoughts. And then lastly, one thing you can taste. So I'm going to sip my tea. Now I recognize a lot of people in school might not have something to taste. There has been times with teachers' permission, of course, I've had kids bring mints in, and when they're really anxious, have them suck on the mint and focus on the sensation of the mint, how it tastes, and how it's dissolving. So essentially this took probably like, 2 minutes? Enough for me to, whatever maybe was making me anxious, bring me back to the present moment, distract me. So maybe my anxiety was initially at an 8, maybe it's at like a 4 now. So it didn't solve my problem what made me anxious. It made me more aware, brought me back to the present moment, and in turn, hopefully helped me respond. And if I didn't do that, I would have reacted. I know you guys said in the beginning with the poll, there was more teens. I wanted to give you guys one little one for kiddos too. A lot of times with anxiety, we have to look at the symptoms, and a lot of times with your kids say, I feel like I can't breathe. So one way to help with that and come back to the present is helping a child focus on breathing. Now this might seem silly, but it works for little kids to get their attention, which isn't always easy. Is I'll have them hold 5 fingers up, so we're focusing on something else in the moment is our hand, and I'm gonna have them blow out their birthday candles, all 5 of them. Not only that, but I'm gonna have them breathe in slowly through their nose, each one, and blow out their birthday candles. So I'm having them focusing on something else, focusing on counting, but I'm also having them regulate their breathing by breathing in and breathing out through their mouth. So that's just a little tool I use. Make sure I didn't forget anything. Yeah. I was going to initially end with a little meditation for everyone here, so I'm sure we all could use a little downtime with everything we're going through, but I think with time's sake, I'm going to end it there. But if anyone has questions, please feel free to ask me.
Thank you for demonstrating that.
Sure.
So there was a question in the chat that I wanted to address. And that is, are you going to address the various ways anxiety may manifest in a child? Is it common to become destructive and argumentative? Yes, that does happen. Alex, please feel free to chime in here with me. You can see them get argumentative, destructive, mean, angry. You can see them, they might feel sick, their belly hurts, they have a headache. They might want to be like isolate or want to be alone. They might be the opposite. They might be super clingy. Is there anything else, Alex, that you can?
No, I mean, that question, it just speaks so much to me. Because I think a lot of the kids and teens that were initially brought to me, it was initially for anger issues or aggressive or being so aggressive. And after exploring like what was going on, it turned out to be anxiety just manifesting. And I always tell people, I'm like, usually anger is a secondary emotion. It's usually driven by something else. So we got to figure out what else is driving that anger. And usually anger comes out, we react, we have so much stuff going on. I mean, imagine a kid not knowing what's going on. All these ruminating thoughts, my heart's racing, I'm always sweating, I can't sleep at night, I'm always irritable. Of course it's going to come out as anger.
Yep.
I mean, I can speak as an adult when I've been anxious. It might come out in a way that I necessarily wouldn't act because it's a lot.
Mm-hmm.
That's why working on the coping skills is a big step, trying to self-soothe and self-regulate.
Another question that we got was, how do I talk to my child about COVID? And that's a tough one. Because again, like as Alex kind of mentioned before, like we're all in this together and kind of learning how to navigate and talk about it and deal with it all at the same time. So how to talk to your kid about COVID, I would say being as factual as possible without trying to be scary. So saying something along the lines of, COVID is a sickness, and some people get it and some people don't. And that right now we're staying in our houses and we are going to be wearing our masks and are going to be washing our hands. Just so that we can try to stay safe and try to stay healthy.
And to reassure some of my younger kiddos about the anxiety, I always end with something like, I know your caregivers are doing everything they can to keep you safe. So trust what your parents are saying, the things they're telling you. They're doing it to make sure you're safe, and they're going to do everything they can do to keep you safe. Just as like, here's like the news, and then I'm going to tell you, you're still safe, and we're taking these steps to make sure you're safe, to kind of ease that anxiety a little bit.
Does anybody have any other questions? Dr. Nuthi should be joining us shortly, but in the time that we're waiting for her to come, I guess I would also, if you are feeling up to sharing, whether it be in the chat or verbally, what has been working for you guys as caregivers, guidance counselors, teachers, parents, what is working, what's helping with your children, what's helping you guys to navigate this time? Is there anything that's been, that you have found that's helped you be successful? I know one thing that that's been mentioned to me that has been really helpful for kiddos is when their teachers are like super playful. They seem to be really enjoying that with the virtual learning. So I know that that's been helpful for them. It's also been helpful for them to just have access to their parents and be able to talk to their parents about it. And also just to know, like, from their parents, like, hey, like, I get it, I understand, like, this is tough. And have them not necessarily be trying to solve the problem all the time, but like hearing from them and feeling validated and like, okay, we are in this together. All right, so I got some more comments. As a counselor, normalizing feelings and helping them distinguish between what they can control and what they can't control. Then making a plan about things they can control. Absolutely. Yes, that is huge, especially with anxiety, feeling like you focusing on the things that you can control. We also have story time with the younger kids if they're interested. Definitely, that can be helpful as well. Thank you so much for sharing. The doctor has joined us. So I'm going to stop sharing and say hello to Dr. Nuthi.
Hi, everyone.
Hi.
Hello. Alice, oh, Allison, I'm sorry. Were you done?
Yes,
You're okay with me getting started?
I am.
Oh, okay. All right. Hi, everyone. Allison had asked me to speak about anxiety. I'm Dr. Nuthi, and I've been working at Lenape Valley for about 3 years now. So Allison asked me to speak about anxiety, and I bet nobody's feeling more anxious than I am right now. So let's just get started. And I will also share my screen. Oh. All right. You can see my screen?
Mm-hmm.
Yeah. Okay. Anxiety is normal. I'm sure Allison covered that, and everyone experiences anxiety, this diffuse, unpleasant sense of apprehension, worry, unease, nervousness, which are manifested by symptoms connected with the autonomic nervous system. And we will talk about the autonomic nervous system in a little bit. Anxiety disorders are the most common childhood onset psychiatric disorders. To qualify as a disorder, anxiety has to be persistent, excessive, unable to control, causing significant distress or impairment in functioning. So for anxiety to meet the criteria of a disorder, these are the requirements. The CDC says about 7% of children aged 3 to 17 years, it's approximately 4.5 million children have diagnosed anxiety. And recent estimates say that over 30% of teens have an anxiety disorder. During adolescence, the brain goes through a rapid proliferation of neurons and their connections. The very structures and connections in the brain that help to manage emotions are in a flux during this developmental period, making teens especially vulnerable to stress and anxiety. On a positive note, there's evidence that both cognitive behavior therapy and medication treatment may help the brain circuits regulate fear and keep them from overreacting to potentially anxiety-provoking situations. Children's brains have experience-dependent neuroplasticity, which means that every experience we expose them to has the capacity to change and strengthen their brain. So multiple factors contribute to an anxiety disorder. The biological factors are genetic predisposition, thyroid problems, withdrawal from drugs and alcohol, heart disease, irritable bowel syndrome, and some other medical conditions. The psychological factors include temperament, personality style, usually timid or avoidant personality styles are more vulnerable for anxiety disorders. Unresolved psychic conflict and learned behavior or conditioned response. I have a personal, very concrete example of this learned behavior that I can share with you. My dog phobia is based on a real life experience. However, my children's dog phobia is a learned behavior and a conditioned response from them just watching my reaction to dogs. And the social factors involve family, peers, environment, various experiences, and trauma. Just as the causes are multifactorial, the treatments have to be multidimensional. We need to address any underlying medical conditions, avoid drugs and alcohol, watch the biological circadian rhythms, and medications. Psychological treatments involve therapy, especially cognitive behavior therapy, which has proven to be just as effective. And together with medications, together they're more effective than each one alone. Stress management. Exercise is a powerful stress buster. It reduces the sympathetic nervous system activity and the HPA axis reactivity, which we'll talk in a little bit. But it also decreases anxiety sensitivity. As Allison mentioned, I'm sure she mentioned all the symptoms of anxiety, and a lot of them are the same physiological changes you would notice in physical exertion or excitement, like the racing heart or fast breathing. So exercise can decrease our sensitivity to these anxiety symptoms and facilitate habituation to these feared sensations. Besides, it also increases endorphins. There are several ways exercise really is a powerful stress buster. Social factors involve healthy relationships, reducing stressful situations if possible, healthier pursuits, time management, decluttering our lives, predictable routines. Uncertainty is a big factor causing anxiety. So we will focus on the biological parts. The nervous system comprises of the brain, spinal cord, and the peripheral nerves, which is like the hardware, and the psychological and emotional system make the software. As you know, the hardware and software need to work together nicely for things to run smoothly. Emotion is rooted in basic drives like hunger, pleasure, pain, fear, aggression, which is shared by all animals. The neuroanatomical basis for these drives is centered in the limbic system. Here we are. Limbic system is evolutionarily an old system. It has several structures that together form the limbic system. The most, I guess, most prominent or well-known structures are the amygdala and the hippocampus. The limbic system processes all the internal and external stimuli. Information from the primary senses is interwoven with the internal drives like hunger, fear, pain, pleasure, etc., to give emotional significance to these sensory experiences. Amygdala is like a communication hub between the parts of the brain that process incoming sensory information and the parts of the brain that interpret these signals. It can alert the rest of the brain that a threat is present and trigger a fear or anxiety response. Hippocampus is the part of the brain that encodes events into memories. Regulation of these basic drives and the responses are processed by the frontal lobe, which is in the very front of the brain. Evolutionarily, this is a newer part of the brain, which is more developed in humans. The left brain is the logical side, and it uses language to describe experience in a concrete, logical way. The right brain is the emotional side and looks at the bigger picture of what the experience means. It draws on our memories, feelings, and images. During anxiety, the right brain takes over temporary control. The feelings are overwhelming, and without the full involvement of the left brain, the feelings don't always make sense. A balance between the right and left are necessary to maintain normalcy. So this is the basis for the age-old advice, stop and think. I just had a little cartoon about, this says, our left hand doesn't know what our right hand is doing, so we're only interviewing ambidextrous candidates. So I thought it was funny. All right, where are we? So the main purpose of the autonomic nervous system is to maintain homeostasis, a sense of balance and harmony. Autonomic nervous system is the part of the nervous system that controls the involuntary responses and functions necessary for life, like the heartbeat, breathing, urination, digestion, and so on, without a person's conscious effort. Thank goodness they're automatically taken care of. I wouldn't trust myself with that. The autonomic nervous system partners with the hypothalamus, pituitary, adrenal axis. This is the hormonal system to form the stress response. The autonomic system has two components, sensory and motor. The sensory component gets input from all the peripheral senses, vision, hearing, smells, etc., but also from the internal sensors like blood glucose level, blood oxygen level. The motor component has a sympathetic and a parasympathetic branches or sides. They serve antagonistic roles, kind of like the opposite sides of a coin, but keeping it together. The sympathetic nervous system is what drives the flight or fight response. When there is any threat perceived, the sympathetic system releases adrenaline and noradrenaline. Every physical symptom that comes with anxiety, like the racing heart, clammy skin, vomiting, shaking arms, legs, everything, is because of a surge of these neurochemicals. The natural end to the fight or flight response is intense physical activity by fighting or fleeing. If the threat was real, then these chemicals would be used up in that response. Well, when there is no need to fight chemicals, there's no need to burn up these chemicals, and they build up, causing the physical symptoms of anxiety. The parasympathetic part of the autonomic nervous system is what restores the body to the resting state. And it usually works by a chemical called acetylcholine. So neurotransmitters are the chemical messengers made by the nerve cells specifically to transmit messages to other cells. These are the targets there. These are the targets for drugs. The three major neurotransmitters associated with anxiety are norepinephrine. Let me go back to this slide. Norepinephrine, serotonin, and gamma aminobutyric acid. And almost every anti-anxiety medication falls into one of these categories. The older antidepressants, they also block the serotonin reuptake, but along with the norepinephrine. Effexor, Pristiq, and Cymbalta are all, they work on the serotonin and norepinephrine system. Wellbutrin works on the norepinephrine and dopamine system. The newer, relatively newer, and some of these are new too, but the selective serotonin reuptake inhibitors are that category, because a lot of these medications affect multiple chemicals and multiple receptors. They tend to have more side effects, and because these are more selective in their action, they tend to have fewer side effects. Gamma aminobutyric acid is an inhibitory neurotransmitter, and the benzodiazepines and gabapentin work through this system. Alcohol also works through the GABA system. And so this is how the medications work in simplified terms. So this is the synapse. So this is presynaptic, this is postsynaptic. So these are the vesicles, and the neurotransmitters are released into the synapse and picked up. Some are picked up by the receptors, and that's how they affect what this cell will do. Once they act, some of them are actually reabsorbed or uptaken, I guess. So this is where a lot of the medications work. So the serotonin reuptake inhibitors prevent some of the reuptake, so there's more serotonin or more norepinephrine in the synapse for it to work better. And at the very end, I want to say, brain is such an amazing, complex structure, and I don't think we know the half of it. And that I would end. And
thank you, Dr.
the
Nuthi.
screen sharing.
We do have a question for you.
Okay.
Someone asked if there are any alternatives to pharmaceuticals such as CBD.
You know what? That is a really good question. I have not looked into CBD that much. I really, I work with a lot of younger children, so I'm really not familiar. That's a really good question, and I would like to learn more about it. Yeah.
Before we end today, does anyone have any other questions? Well, thank you all so very much again for participating, for being here. We really hope that it was helpful. Thank you for hanging in there with us as we did this virtually. And if you wouldn't mind, Jessica did send a link to SurveyMonkey. If you wouldn't mind completing the brief survey, just to let us know how we did and how we can improve, so that hopefully we can continue doing this for you guys. Thank you again.
Thanks for having me, everyone.
Thanks, Alex.
Thank
Thanks,
you.
Dr.
Bye-bye.
Yuki.
Bye-bye.
Thank you.
You're welcome, Allison.